So now your baby is born, you've welcomed them into your arms, you've welcomed them into the world. What should you expect the healthcare personnel will be doing in terms of procedures, screenings, and preventative measures? Let's get to it. Hi everyone, my name is Jessica Lam and I'm a board-certified pediatric nurse practitioner here to help you learn all things pediatrics. First things first that I wanted to talk about is possibly taking a newborn class before baby is born. The hospital that I'm going to, they actually offer these classes. They had newborn classes, breastfeeding classes, they also had understanding birth classes, so it was very helpful for me to kind of reiterate information that I've known, but also learn more things, as well as just taking my husband with me, and so that he can learn and know what to expect in those specific part of my life when I'm breastfeeding or when I'm actually doing the labor and delivery process and when the newborn actually comes. So I thought that was very helpful. So go ahead and research if you have any local resources that you can touch base on that. So let's start. First things first that they're going to do is suctioning. Basically, when baby comes out, there's going to be a lot of fluids. They're going to suction the fluid out of the mouth and out of the nose to help baby breathe. Pretty self-explanatory there. You've probably seen it in social media or in TV. That's going to be the first thing they're going to do. Second thing is APGAR scoring. So APGAR scoring is basically measuring how they're transitioning out of the womb. They measure this at 1 minute of life and 5 minutes of life. And basically APGAR is an abbreviation and they measure it at 0, 1, and 2. And a score of more than 7 is usually normal. A score of less than 7, typically you would need interventions to be able to, get baby to get to a higher score. Next thing they're going to measure is your weight, your length, your chest circumference, your head circumference, as well as some vitals, including your temperature. Basically, for weight, they are considered with 3 different categories. You have your SGA, AGA, and LGA. SGA is your small for gestational age babies. Basically, they are less than 10th percentile. AGA is your 10 to 90th percentile babies. And LGA is your large for gestational age, which is your greater than 90th percentile. Basically, with SGA and LGA babies, they have certain risk factors that medical providers look for. So that's just to kind of categorize the babies and make sure that we're checking specific risk factors if they're under a specific category. Another thing, biggest thing with weight is that the birth weight of your baby, because they're going to be asking that on your newborn well visit when you see your pediatrician, because it is expected for them to lose about 7 to 10% of their birth weight in that first 2 weeks, and then essentially gain that back in that second week, and then make sure that that they're feeding well, peeing and pooping during that first 2 weeks. So it's really important to know what their birth weight is and making sure you communicate that to your pediatrician. Our next section is going to be about preventative measures. So preventative measures, you're reducing the risk of certain diseases. We're going to talk about 3 things: erythromycin ointment, vitamin K injection, and hepatitis B vaccination. First things first, erythromycin ointment is basically a topical ointment that they put in the eye in the first 24 hours of life. It's basically to reduce the risk of what's called gonococcal ophthalmia neonatorum. It sounds like a Harry Potter spell, I know, but it's a very serious newborn eye infection that can be transmitted from the mom's cervix. So typically they give this even if you're a vaginal delivery or a C-section, to just prevent this disease. Usually, prevention in general is, making sure that they catch that prenatally in prenatal care, but sometimes they test for it and then the mom gets it after that testing. So it's just best practice to go ahead and reduce that risk. Complications that can happen if it's left untreated is scarring in the cornea of the eye, perforation or a rupture or a hole in the globe of the eye, essentially leading to blindness in that first 24 hours that you could see. That's why it's very important to give it right away, right after birth. Next is your vitamin K injection. So basically it's an injection given in the baby's leg muscle, and it's to prevent what's called vitamin K deficiency bleeding. So typically, kind of just looking at pathophysiology here, typically babies are born with very low levels of vitamin K. And what does vitamin K do, or why is it important? So vitamin K is very important for blood clotting. So if you're not having enough levels of it, because babies have low levels of it, you are at risk for bleeding. So no vitamin K, you have less clotting. So then you're bleeding. So one of the reasons that this can happen, if you have vitamin K deficiency bleeding, half of those babies actually can bleed into the brain. So that is a very, very serious complication for vitamin K deficiency bleeding, is brain bleed, essentially death, sometimes needing surgery because that bleed is so much. So basically this is given within the first 24 to 48 hours of life, and it's to just prevent this complication that can happen, and it's better to prevent than to treat. Next is your hepatitis B vaccination. So this is basically another injection in the leg muscle of the baby, and it's to prevent a virus infection called hepatitis B. So hepat means liver, itis means inflammation. And these are the complications that can happen if hepatitis B is left untreated. Liver inflammation, liver diseases, liver damage, and liver cancer. Typically, you can prevent this. The best way to prevent it is by getting prenatal care. Mom can be diagnosed with hepatitis B and going from there, but it could be transmitted because mom has it, baby can have it, and also through close contacts with other people that have hepatitis. So typically this is given, right at birth, and then usually you'd have boosters, about 3 to 4 total, afterwards at your pediatrician's office. So making sure that you consult your pediatric primary care provider regarding those boosters. It has a 95% effective rate to be able to reduce the risk of hepatitis B. And with that, with your vitamin K, erythromycin ointment, and hepatitis B vaccine, I did attach some links below from the CDC and some reliable resources so that you can read more about it, more about the recommendations and what it's for. I am planning on giving all of these to my babies just to prevent all these conditions from happening. So now let's talk about screening. So screenings is basically just trying to detect things that can be potentially dangerous to the baby. Number 1 is newborn screening. So newborn screening, basically they do a quick prick in the heel, send that blood sample into the state laboratory. It takes about 1 or 2 weeks to get the results, and it's to check for rare genetic and metabolic conditions or diseases that could potentially be life-threatening to the babies. And when we catch it early, then we can have early intervention and plug the baby in with specific specialties to be able to handle that condition. Some of the things that you probably heard about in terms of newborn screenings that they detect is cystic fibrosis, sickle cell disease or sickle cell trait, or any thyroid issues like hypothyroidism or hyperthyroidism. So with this, it differs per state. I live in the state of Florida. They detect about 36 core conditions and then about 23 additional or secondary conditions with a total of 59. It differs per state, like I said, so if you're curious about that, do your own research and see what they check in the newborn screenings for your specific state. Another one would be your CCHD screening, or your critical congenital heart disease screening. Basically, they put a little pulse oximeter probe on the right hand of the baby and then another one on the left or right feet of the baby and measures the oxygen levels with those specific extremity and then measures the difference between them. If there's any sort of abnormality, they then refer to the pediatric cardiology team to make sure that they have the appropriate intervention, appropriate diagnosis, appropriate treatments that they need if they catch something early. Next is your hearing screen. So this is typically done between 24 to 48 hours of life to detect hearing loss. So essentially you can prevent further speech delays. Usually if it's abnormal, they repeat the screen, and if that's still abnormal, they will essentially refer you to a pediatric audiologist outpatient to be done as soon as possible, or no more than 3 months of age. And lastly, I'm going to talk about bilirubin screening. So what is bilirubin? Bilirubin is basically a yellow substance that is produced when red blood cells are broken down, and then it is basically excreted or removed by the liver. Prenatally, so before a baby is born, typically the mom's liver is the one breaking down that bilirubin. Once the baby is born, they can become jaundiced or looking yellow because their liver doesn't quite know yet how to process that bilirubin and doesn't know how to remove it. It is very common to have jaundice. Breastfeeding babies typically would have jaundice or breastfeeding jaundice for a good month. Usually that's sometimes because it's a low supply of the breast milk or they have poor latching. It's usually a breast milk supply issue. And typically, that's why it's really important to feed them every 2 to 3 hours and making sure you're monitoring the urine and the stool outputs, and that you are plugged in with certain resources like your lactation consultant to be able to make sure that that's not what's what's causing it. Another one would be your formula feeding babies, usually typically resolves by 2 weeks of age. With bilirubin, it could be common, like I said, but it could also be life-threatening when it builds up so much. So this is why it's very important to see your pediatrician for those well visits, because they're going to be assessing this with every single visit in those first few weeks. So with that, what can happen is that your bilirubin can build up in the system, crosses the blood-brain barrier. I don't know why I did that. It crosses the blood-brain barrier, and then it goes through the brain and the spinal cord. It essentially can lead to brain damage or a permanent neurological condition called kernicterus. And kernicterus can cause cerebral palsy, hearing loss, vision and teeth issues, and developmental delays. So that's why it's so important to be able to check bilirubin levels so that we can prevent this very serious complication. And when they look at the bilirubin levels and looking at risk factors as well, they're going to see if you are below or above the threshold to get phototherapy. And phototherapy is basically the treatment for it. Your baby is placed on a special light with their little cute little sunglasses to be able to just get that jaundice or get that bilirubin levels to go down. And with that, one of the biggest takeaway I wanted you to take advantage of is to use your resources and the staff at the hospital after you give birth. Your nurses can help you learn how to swaddle, change a diaper if you don't already know, proper feeding techniques if you want to do formula feeding, and then your lactation consultants could be there as well. They can teach you about breastfeeding, they can teach you about pumping. If you're even interested before this labor and delivery process, there are classes as well that you can take. See if your insurance can cover it, or if they have those options for classes for you. Those are great resources that I used as well. And then lastly is car seat technicians. Sometimes hospitals have car seat technicians that can help you make sure that the car seat base is completely, settled and completely safe, and then making sure that the car seat gets in there pretty safely. What I did was basically go to a fire department prior to my due date, just to make sure that I had it even beforehand. I'm not worrying about it, but some hospitals also offer car seat technicians in their actual resource there in the hospital. So take advantage of that, guys. They are there for a reason. They know the resources around the area, so make sure you ask your questions there. And that's a wrap. I hope you found this information helpful. Don't forget to like, subscribe, or comment down below for any other topics you'd like for me to cover. Thank you for going through this with me, and I hope I see you at the next video. Bye! Hey guys, so I actually just gave birth right after making that last video. I had my OB appointment right after it, and the magic happened. The baby came out. So if you're interested with the vlog, I am going to be making one when the contractions happened, basically how the room looked like, how discharge was, and some of the things that they did with the baby when we were alive, when we were actually awake during the process. It's going to be all in that vlog, so stay tuned. See you!